Hello, my name is Luciano Garcia, Assistant Professor at Texas Women's University Institute of Health Sciences, Houston, Texas. I want to talk to you about my study, The Impact of Blood Flow Restriction While Pushing a Sled, an exploratory study. I want to thank my colleagues, Dr. Wayne Brewer and Dr. Martin Rosario, there at Texas Women's, as well as very current newly licensed DPTs, Megan Skevington, Lydia Smith, and Haley Waters. Introduction. Physical inactivity is a growing problem worldwide, leading to severe muscle loss, weakness, and poor performance. To help combat this, training can be performed at either high intensity, which is greater than 65% of a person's one repetition max, low intensity training, which is at a lower level, 20 to 30% of one repetition max. And this can be performed along with blood flow restriction training. Blood flow restriction training, if you're not aware, is if you look at that bottom left picture, you will see the therapist standing and they're holding a little unit there, and it's got a tube connected, a tube coming out, and that's connected to the subject's cuff. You'll see the cuff wrapped around the proximal thigh, and it produces an occlusion of the subject's femoral artery and vein, which occludes blood supply from there distally throughout the lower extremity. And that has been proven to improve muscle hypertrophy and strength. This study will use sled pushing, which is the other picture on the bottom center. You can see the subject pushing a sled while they have the BFR on their leg. And combining the BFR with sled pushing could be useful in addressing overall fitness. The purpose of our study is to compare lower extremity muscle activation with and without blood flow restriction application during slow and fast pushing in young, healthy adults. So we're going to have them push at two different speeds, a slower speed and a faster speed. Our methods, we recruited 31 Texas Women's University, Houston male and female students over the age of 18, and we had a 30-year-old cutoff age with no activity requirement. After we obtained IRB approval, we recruited the subjects. We had them read and sign the consent forms. Afterwards, they were educated on the study, and we recorded their height, their weight, their blood pressure, and we determined their dominant leg. On that dominant leg, we used 6 surface EMG electrodes. They were to the tibialis anterior, the gastrocnemius, the vastus medialis, the biceps femoris, the gluteus maximus, and the gluteus medius. So if you remember, that cuff is there on the proximal thigh. 4 of those muscles are distal to it. 2 of them are proximal. The glutes, the med, and the max are proximal to the cuff. The other 4 are distal to it. We then recorded their baseline MVIC, their maximum voluntary isometric contraction, and all amplitudes from here are a percentage of that maximum. Once again, we had them push 40 feet to a metronome beat. For each beat of the metronome, they performed the sled pushing at 140 beats per minute, and they also did conditions at the slower 80 beats per minute speed. They did 3 trials each. They did it with BFR on that dominant leg and without BFR on the dominant leg, with a 3-minute rest in between. Instrumentation used, the EMG unit were 6 Delsis surface EMGs. The sled was XPO brand, and the BFR unit was the Delphi. Statistical analysis included, well, first we normalized the data with the EMG Works analysis, and then we analyzed the data using SPSS, using a repeated measure ANOVA,
with an alpha level set at 0.05.
The results, we analyzed each one of the six muscles for their minimal, their maximal, and the overall average amplitude for each one of the conditions. What we found at the 80 beats per minute, at the slower one, the ANOVA revealed significant interaction of the BFR group and muscle with the average intensity and the maximum intensity. And that was at 80 beats per minute. At the 140 beats per minute, main effects were found between muscle groups with the minimal amplitude for the conditions. A separate ANOVA found what we compared 180 to 140. Main effects were found at the faster speed with increased activation of all six muscles, most notably the gastroc and the vastus medialis. Our discussion points at the slower speed, at that slower 80 beats per minute speed, EMG amplitude increased in the powerful pushing off muscles. Those were the gastroc, the vastus medialis, and at the slower speed, the glute max. It was able to keep up and help push the sled and push the subject forward. And that was with the BFR conditions. At the faster speed, only the gastroc and the vastus medialis had enough time to keep up with the pushing off. So they had to be a quicker type muscle for the force to push the leg into terminal extension position. Interesting to note, at either pace, the gluteus medius, remember it was proximal to the cuff, it functioned at similar levels regardless of speed and regardless of with or without BFR. Similar studies, Wilk et al. 2020 found that blood flow resistance training can help increase peak concentric velocity with resistance training. Sousa et al. 2017 found blood flow restriction training produced similar results to high intensity exercise. And that's very, very important to note, especially in rehabilitation. Lots of subjects or patients are not able to perform high intensity. Remember, that's greater than 65% of a 1 rep max. Think of your patients after surgery. Think of an elderly patient. Think of a patient fighting cancer. They are unable to produce high intensity, so we have them perform lower intensity exercises like pushing a sled. And this, along with previous studies, have shown that BFR with the lower intensity type exercise can produce similar muscle contractions to higher intensity exercise training. In conclusion, the use of BFR at slow speeds improve muscular contractions of the gastroc, vastus medialis, and the maximus. At the faster speed, BFR improved amplitude in the gastroc and the vastus medialis. Clinically, this can be applied by utilizing BFR at different speeds. So have your patient perform an exercise with BFR at different speeds to help target specific muscles. Limitations of our study. These were done on healthy subjects, so generalizability is limited. And future studies should perform this BFR protocol on patients with pathology. Thank you.